Diagnosis of cluster headache is basically clinical. All you need to do is to take a thorough history and do complete examination. The periodicity and rhythmic pattern is very specific to it and not found in any other type of headache. Also note that lab investigations or imaging studies are not helpful except in cases where there is need for excluding other types of headache. And that is why we should keep in mind its common differentials. The common differential diagnoses of cluster headache are migraine, uncontrolled hypertension, eye disorders like acute optic neuritis and acute glaucoma, intracranial bleed, intracranial neoplasm, trigeminal neuralgia, and chronic paroxysmal hemicrania. Now you must be thinking that migraine is also a very severe kind of unilateral headache. So maybe there is some confusion between them. So here are some points which will help you differentiate between them. First one is duration. Migraine lasts for a longer period of time, minimum 4 hours until 72 hours, while you know that episode of cluster headache is 15 minutes till 3 hours maximum. Second is pattern. Like in migraine, there are 2 to 4 episodes in a month, while you already learned that cluster headache can be 1 to 8 episodes in a single day. The severity of migraine is reported till 6 to 7 out of 10, while cluster headache is much more severe and patient report it as 10 over 10. In migraine, the patient prefers to sit in a calm, dark and quieter place, while in cluster headache, the patient is agitated, restless, moves here and there in the room and wants to bang his head against a hard surface. Migraine is preceded by a period of aura which warns the patient, and the patient tends to take abortive medication at right time, while cluster headaches usually begins without warnings. Migraine patients suffer from nausea, vomiting, disliking of light and sounds, means photophobia and phonophobia, while as I told you earlier that cluster headache is characteristically accompanied by ipsilateral rhinorrhea, lacrimation and Horner syndrome.